There are more genetic tests available than ever before. You can access them in a healthcare setting, but also via online direct-to-consumer testing. Because genetic testing itself has gone mainstream, even if you're not individually having any level of testing, you might be biologically related to somebody who is, and so the questions that they are having answered could be very relevant to you. Often people don't know they're going to have an emotional reaction about the testing results until they have that reaction, and it's really hard to anticipate before testing. And so genetic counsellors are needed on a massive scale now. Testing itself is snowballing, and so is the urgency and need for genetic counselling to accompany that. Genetic counselling is not just information giving about genetics. Really, any health professional can do that sensitively. You walk for a moment in somebody else's shoes and you get to experience through their eyes what the genetic information means for them, so that you can then help them to make decisions that are meaningful for them about their lives and their children and their family.
Genetic counsellors are experts in helping families to understand really complex genetic information resulting from the genetic tests that have been done as diagnosis tests, and explaining those to patients to break down the jargon and to help them understand what that means for themselves and for the rest of their family, and for making decisions for their future, and for deciding sometimes about what they need to do to keep themselves healthy in terms of screening or management of a condition, or about what to do when it comes to having children. And so genetic counsellors are able to integrate all of the different bits of information from the science, the health side, and also to help them with the worries and anxiety and family communication issues, to integrate all those things together to help families have a way forward.
Genetic counselling is quite a unique combination of skills, really. So you've got the genetic laboratory scientific side of things. You've also got the medical health side of things, so asking patients about their health, helping them think through options, so reproductive options, screening, risk-reducing options, depending on what their health condition is. And then there's also this other aspect of really kind of complex psychosocial counselling skills that we bring in as well, to help families cope with their genetic diagnosis and cope with that feeling of having passed something on to a child, which for a lot of parents that can have a really big impact.
Living with the burden of a genetic condition affects the family as a whole, and individuals need to find ways to share that information in their family, communicate to their children in a timely and appropriate and supportive way. And families often struggle with this, and genetic counsellors have a lot of experience in helping families think about the best ways to communicate, helping them identify who in their family needs this information, and to support that communication process.
Following on from that, a really key skill for genetic counsellors is empathy. There is an element to which it's important to have the emotional aspects of empathy, but also the cognitive aspects, so really understanding where someone is coming from. And I think that's really important as people make difficult decisions.
Genetic counsellors combine this advanced knowledge of the science of genetics and genomics with the art of caring and communication skills to help families and future families.
We know from work that we've done that many healthcare professionals don't know that much about genetics and don't know that much about genomics. So as professionals who are trained in genetics, really genetic counsellors can use those skills not just with the patients that they see, but in training the wider workforce and communicating that information to the wider workforce in a way that's relevant to their role. When we're thinking about mainstreaming genetic testing, we're really thinking about equity of access to care. We need to make sure that all healthcare professionals who might order a genetic test are skilled to be able to order the appropriate test for the appropriate patient.
As a research genetic counsellor, I'm very interested in exploring the evidence base that underpins the therapeutic alliance. How is it we can have meaningful conversations with people about genetics? The whole point of all of this research is to understand and ultimately improve and feed back communication processes into health services, and also feed those into policy.